Welcome to GutTalk TV, a YouTube channel focused on closing the communication and knowledge gaps in gut health.
Please see our disclaimer and press the subscribe button below.
Hello everyone, I'm Jakob.
And I'm Dr. Yoon. We are gastroenterologists from Australia. Today we are going to talk about Methotrexate. Methotrexate is an immunomodulator, meaning it reduces inflammatory response. You may also hear it by called brand name methylblastin. It can be taken as an oral tablet or as an injection.
Your doctor has recommended methotrexate due to your active IBD despite other therapies that may have been tried. Treatment with methotrexate aims to prevent flare-ups, reduce the need for using steroids, and improving your well-being by reducing or preventing symptoms including diarrhea, bleeding, and pain. Ultimately, we're trying to heal the gut by reducing inflammation. Methotrexate can be used in combination with other IBD medications.
In IBD, the immune system is overactive. Methotrexate works by reducing and controlling inflammation in your bowel by dampening down the immune system.
These medicines take some time to work, and it takes 1 to 3 months before you see the full effects of methotrexate. You may need to be treated with other immunosuppressants such as steroids or dietary therapy such as EEN until the methotrexate kicks in.
Methotrexate can be administered as oral tablets or as a subcutaneous injection. Tablets should be taken on a full stomach. Generally, methotrexate is taken once a week, but sometimes your doctor may split the dose into 2 days in a week. Methotrexate injections are administered under the skin and generally in the stomach or thigh and administered once a week as well. It is recommended to take folic acid, which is vitamin B9, to reduce possible side effects. Folic acid should not be taken on the same day as methotrexate. There are no special precautions that need to be taken when handling this medication. Before you start methotrexate, the IBD team may request blood tests, including your blood count and liver function test. You will also be screened to check whether you're up to date with your vaccination and for certain infections before starting this treatment. Your IBD team may recommend that you have a specific vaccination prior to commencing methotrexate.
All medications can cause side effects, although not everyone experiences them. You will be monitored for side effects by your treating physician and team. Some patients can experience nausea, vomiting, a loss of appetite, fatigue, mouth ulcers, or rashes when they first start taking methotrexate. Often these symptoms resolve as the body becomes used to the new medication, although some patients may need to swap to an alternative treatment. Methotrexate may increase your risk of infections such as the common cold and sometimes other more serious infections. Please contact your doctor or team if you have any symptoms of infection, including fever. Less common side effects include lung and liver problems. There is some evidence that methotrexate may slightly increase the risk of lymphomas, which is a cancer of the blood. Shingles can sometimes develop while on immunosuppressive therapy, which is a painful rash occurring in patients who've previously had chickenpox. If you notice this type of rash, please see your GP, ideally within the first few days of seeing the rash, as you may need antiviral medication to treat this.
Let your treating team know if you're experiencing side effects or think you might be getting an infection. Your IBD team will monitor your response to treatment by tracking your symptom as well as blood and stool tests, and in some centers, intestinal ultrasound. After 6 to 12 months of treatment, your IBD team will likely recommend endoscopy to check the gut healing, as this is an important target of treatment. Regular blood tests can pick up abnormal findings in the blood that cannot be produced symptoms straight away. Initially, blood tests may be required every few weeks. Your IBD team will discuss and provide a blood test monitoring schedule.
Women who are trying to conceive or are pregnant should not take methotrexate, as it can increase the risk of miscarriage and birth defects. Women of childbearing age on methotrexate should take reliable contraception. Women planning pregnancy are advised to see their team or doctor and ideally stop methotrexate 6 months before conception. Methotrexate may decrease sperm counts, but is not associated with any adverse birth outcomes. Therefore, methotrexate can be continued in men planning to father children. However, if there is difficulty in conceiving, then it may be helpful to stop methotrexate. Methotrexate passes into the breast milk and can affect the baby's immune system and growth. Therefore, breastfeeding should be avoided while taking methotrexate.
I hope you find this video useful, but if you have any question, please leave in the comment section below. Thank you very much.